I'm really sorry that my videos keep cutting off. I'm probably just gonna maybe in the future use my husband's phone or something. So anyway, the heart racing thing was horrible. I finally went to the cardiologist and he said, you know, you don't have an arrhythmia, you don't have supraventricular tachycardia, but he had put me on a heart monitor and he said, you just have tachycardia, your heart's just racing. But they never knew why. They couldn't figure it out. So then I got pregnant again, and it started to subside. I went through this whole period that I was just discussing for 5 months straight. My heart was racing pretty much every day. It was horrible, horrible, horrible. And so I got pregnant again, and it started to subside, and it went away pretty much. So I went through that whole pregnancy. Once again, my symptoms kind of died down. So something about Lyme disease is that when you're pregnant, your pregnancy can mask the symptoms of Lyme disease. So a lot of people feel better when they're pregnant. Not everyone, some people feel worse, but it's not uncommon for you to feel better during pregnancy when you have Lyme disease. So then towards the end of my pregnancy, I started getting really sick, and I was told, I went to the doctor, they told me, I probably just had a virus or something. So I ended up going to the hospital because nobody was really helping me. And it turned out that I had something called C. difficile colitis, or C. diff. It is a horrible bacterial infection that is fatal if it's not treated. So I was really sick, stomach issue sick is basically what it causes. I don't want to be gross with details, but and I was on medicine for 3 months trying to get rid of it. When you're pregnant, there's only one antibiotic they can give you for that. The other one isn't, it can hurt the baby. So I finally got rid of it with this awesome probiotic called Florister, but it was horrible. C. diff is not common in people my age. I'm 27 years old. I was 26 at the time. It's not common in people my age. It's common in older people with bad immune systems and not pregnant women. It is so rare in pregnant women. There's hardly any cases of pregnant women getting C. difficile. So that was something that was bad. Obviously, my immune system is taxed out because of my Lyme disease, but still at this point, I did not know any of what was causing all these things to happen to me. So I had my second child about a year ago, and so it's been about a year. I'm going to just read really quickly through the list of symptoms that I've had over the years and that I continue to have pretty much on a daily basis. Some of these are intermittent, but most of them are every day. So I have horrible anxiety from everything that's happened to me. I have a lot of anxiety about my health. So I have basically chronic pain all over my body, widespread. I was diagnosed with fibromyalgia. I have neck and spine pain horribly. I have arthritis in my spine. I have fatigue, lethargy, heart racing. I have nausea, muscle twitching, facial, like some of my face in patches, sometimes it goes numb in certain areas. I have stomach pains. I have horrible brain fog. Like sometimes I get confused or I don't remember things. I have memory loss problems. I have problems saying words sometimes or speaking correctly, as you can probably tell as I'm doing these videos. I have trouble pronouncing my words. I have Costocondritis, which is where it's inflammation of your chest and cartilage, your ribs. It hurts a lot. I have a lot of chest pain. My ribs constantly go out of place. They just move out of place. I have a lot of muscle pain. I have a lot of lethargy and fatigue and headaches. And, sorry, it's like kind of hard to read my own writing. I have PVCs where my heart just kind of feels like it's skipping a beat or has extra beats. I have a new symptom that just started is neurological skin pain, where it'll feel like my skin is burning, but there's no rash there, there's nothing. It's just a sensation like I have a sunburn. I have numbness and tingling pretty much in a lot of my body, mostly my hands, feet, legs, on my face. I get numb patches like behind my knees, stuff like that. And, you know, I just basically have been going through this for so long that um, it's part of my everyday life. It's not something that I can't really get relief from these things. So when I went to my doctor, this doctor that my friend told me about, I started seeing him, and within a couple times of seeing him, he pretty much knew um, what I had. He said that I believe that you have chronic Lyme disease. I want to test you for it, and I want to start treating you for it. So I was tested. Now, at first, first of all, tests for Lyme disease can be very inaccurate. This is something widely known in the Lyme disease community. Um, but my first test wouldn't actually read. I would get my blood work sent out to this lab in New York, and they said that too many of my cells had died by the time it reached the lab. I tried it 3 different times, it didn't work. My initial Lyme testing, just through like a regular lab, I did have high antibodies for, I think it's called like the ELSA, the antibody test. But they didn't perform a Western blot. So then my doctor had me do one through this place called I.B.S. And through I.B.S, I was positive through their lab. I had 9 positive bands on the Western blots. And basically, I'm not CDC positive, but it's very hard to be CDC positive because they have removed certain bands from that used to be in the criteria, which would mean I would have been positive before they removed those bands. Those bands were removed due to this vaccine that they had put out that failed, and they used some of those antibodies in the vaccine. But people that haven't had the vaccine and test positive for those antibodies and still have them positive, I mean, it's not really fair to those people, you know? So basically, I was positive through the lab. My doctor started treating me last week, and I just want everyone to know that don't give up. If you're sick, if you're going through horrible symptoms and you have a poor quality life, keep trying till you find someone that'll listen to you. I went years with doctors telling me that there was nothing wrong with me, that I was just depressed, and I wasn't depressed. But that's what they said. They're like, you're depressed, you have anxiety, there's nothing wrong with you, you're going to be fine. And that was not true. And I did not give up, you know, because I was like, I'm not going to accept this horrible life. I'm not going to accept that this is just the way my life's going to be. And I urge you all, anyone watching this that has problems, that doesn't know what's causing them, even if it's not Lyme disease, whatever it is, keep trying to figure it out. Don't give up on yourself. Don't give up on the doctors, because yes, there are a lot of doctors out there that don't listen and don't really know how to help, but there are ones that care, and there are ones that are there and they will help you. So I hope that all of you, anyone watching this who's struggling in any way, physically, mentally, whatever, with, you know, things that they've gone through medically, symptoms, you know, please keep looking. I am not anywhere near done on this journey, but I have answers. You know, I have a cause. All of these things that I've mentioned to you that have been going on all my life and that have gotten really bad now in the last couple of years, it's all from Lyme disease. It has infected my entire body. And I don't even know what it's like to feel normal. I've never felt normal. I've never felt like a healthy person. I was bit when I was 5 years old, several times actually. The tick was in me for several days. It broke off in me, and I still have a lot of treatment to go through. I still have a lot of stuff to do, and you know, there is no cure for chronic Lyme disease, but there is a place that they can get you to where you can have a better quality of life, where your symptoms aren't as horrible and just weighing down on you all the time. And that's what I'm looking forward to. So thank you all for watching. I will be posting more videos in the future, and I just want to say, everyone, get better, feel well, don't give up. Please don't give up. There is hope. Someone will be able to help you. But you got to be your own advocate too. You have to, you got to collect your tests. You got to do everything you can to be in charge of your health. Work with the doctors. Know what's going on in your body. Know what your tests say. You know, be in control, because that was something that really helped me. Is I started being an advocate for myself, and I started really getting involved in my medical process. So thank you all for watching, and I will post more updates. Bye.